Okay, we're going to talk about something that is hands down one of the scariest, fastest-moving emergencies a dog owner could ever face. And I'm not talking about a simple upset stomach. We're talking about a condition that can take a perfectly healthy dog and make them critically ill in just a few hours. Seriously, knowing this stuff could actually save your dog's life.
So, just imagine this for a second. It's late at night, your dog seems kind of off, maybe pacing around. Then they start to hunch over and heave, making these awful retching sounds, but nothing's coming up. Maybe a little bit of foamy drool, that's it. It's really scary to watch, and your first thought might be, let's just wait and see. But this is the one time where waiting is the absolute worst thing you can do.
You know, that one single sign, the trying to vomit but can't, that is the big, flashing, red light warning for a condition that needs an emergency vet, like right now. This is not a drill. Every single minute is critical, and what you choose to do in that moment can change everything.
So, what is this silent killer we're talking about? Let's get right into it and break down what is actually happening inside their dog's body when this crisis hits. The official name is a mouthful: Gastric Dilatation and Volvulus, or just GDV for short. Now, you'll probably hear people call it bloat, but that little word really doesn't do justice to the absolute catastrophic chain of events that's about to unfold. To really get why this is so dangerous, you've got to understand the mechanics. Think of it like a two-act tragedy, and it's that second act that turns this into a frantic race against the clock. So stage one is what we call simple bloat. The stomach just fills up with gas like a balloon and gets huge. That's already painful and pretty serious, but the real catastrophe is GDV. That's when that gas-filled stomach literally twists or flips over on itself. And here's why that twist is so deadly. It's not just a tummy ache. When it twists, it seals off the entrance and the exit. Nothing can get in, nothing can get out. But even worse, it cuts off its own blood supply, and often the spleen's blood supply too. Plus, it presses on the major blood vessels, which stops blood from getting back to the heart. And just like that, the dog's entire body is thrown into a full-blown crisis. The stomach tissue starts to die, awful toxins get released into the bloodstream, and the whole circulatory system just collapses. The dog goes into shock. It's this horrible cascade of failures, all set off by that one deadly twist.
Okay, pay close attention because this is probably the most important part of this whole explainer. These are the signs you need to burn into your memory. Catching these early is the single biggest factor in whether a dog survives this.
I'm going to say it again because it is that important. If your dog is trying to vomit and can't, that is your cue. Get in the car. Go to the nearest emergency vet. Do not pass go. Do not call them first. Just go. It is the absolute #1 classic sign. And here are the other clues that help build the case. You might notice a hard, swollen belly, although that can be tough to see on deep-chested dogs. They'll be restless, pacing, just can't get comfortable. You might see a lot of drooling or panting. Sometimes they'll do this prayer position, front end down, butt in the air. They're just trying to relieve that intense pressure. And if you see pale gums or a crazy fast heartbeat, that means shock is setting in.
So let's say you recognize the signs, you did the right thing, and you've just screeched into the vet's parking lot. What happens next? Well, that vet team is going to move, and they're going to move fast, because they know every second counts. After a quick exam, the proof is in the x-ray. A twisted stomach has this really unique look on an x-ray. Vets sometimes call it a double bubble or a Popeye arm, and that tells them immediately that they're dealing with GDV. Okay, the treatment is an all-out blitz. First, they hit the dog with huge amounts of IV fluids to fight the shock and get them stable. Second, they have to release all that gas from the stomach, either by carefully passing a tube down their throat or sometimes by sticking a big needle right through their side. As soon as the dog is stable enough, it's a rush to surgery to untwist the stomach. And finally, and this part is so important, they do something called a gastropexy, where they actually stitch the stomach to the body wall so it can never, ever twist again.
Now, any dog can get bloat, but some breeds are way more at risk. And this number is just staggering. That is the lifetime risk for a Great Dane to get bloat, almost 4 out of every 10. Other big risk breeds are St. Bernards, Weimaraners, Standard Poodles, German Shepherds. You see the pattern? Usually large dogs with those deep, narrow chests.
And this is just the tough, sobering reality of it all. Even if you do everything right and get there fast, GDV is incredibly deadly.
The survival rate is tied directly to how fast you get treatment and how much damage has been done inside. A delay of just an hour or two can literally be the difference between life and death.
All right, after hearing all that scary stuff, I'm sure you're wondering, so what can I do? How do I stop this from happening? Well, let's talk about a game plan. Let's talk defense.
We don't know the exact cause of bloat, but we have a pretty good idea of the major risk factors. Feeding one giant meal a day is a big one. Dogs that wolf down their food really fast and swallow a bunch of air are also at higher risk. And there's a huge genetic link. If a dog's parent or sibling had it, their chances are much, much higher.
So, the good news is we can actually control some of these things. Instead of one big meal, break it up into 2 or 3 smaller ones. If your dog's a speed eater, get them a slow feeder bowl to make them slow down. And this one's huge, no crazy exercise or rough housing for at least an hour after they eat. Oh, and you know how people used to recommend raised food bowls? Well, the latest science actually suggests they might increase the risk, so it's best to stick with bowls on the floor unless your vet tells you otherwise.
But if you want to talk about the single most effective way to prevent this, it's a surgery. It's called a prophylactic gastropexy. And it's basically where the surgeon does that stomach tacking procedure before an emergency ever happens. A dog with a pexy can still technically bloat, the stomach can fill with gas, but it can't twist, and that prevents the life-threatening crisis.
And here's the really brilliant part. For those high-risk breeds, your Great Danes, your German Shepherds, a lot of vets will recommend doing this preventative surgery at the same time as their spay or neuter. Yeah, it adds a bit to the procedure, but it can completely eliminate the risk of that deadly twist later in life. It's a real game changer.
So when it all comes down to it, your best defense against this silent killer is knowledge and being prepared. You now know the signs to look for, you know the risks, and you know the options to prevent it. So the next step is a simple conversation. Talk to your vet. Is your dog an at-risk breed? Do you know their family history? Is a preventative gastropexy something you should be thinking about? It's a conversation that could one day save your best friend's life.